Greetings to all doctors. My name is Alvera Ramlee with the matrix number of BM25110078. I will be presenting my student special module titled The Foundations of Movement, a study on the orthopedic musculoskeletal system. In this presentation, I will briefly discuss the structure and functions of the musculoskeletal system, including the classifications of the skeletal systems, classifications and functions of bones, anatomy of muscles and joints, the process of bone remodeling, and an example of an orthopedic disease. Let's start off with the classifications of the skeletal system. So the skeletal system is classified into two main parts, the axial skeleton and the appendicular skeleton. The axial skeletons consist of the skull, vertebral column, and the thoracic cage. Its main function is to protect vital organs such as the brain, spinal cord, heart, and lungs, as well as to provide structural support for the body. The appendicular skeleton includes the upper and lower limbs, as well as the pectoral and pelvic girdles. This part of the skeleton is mainly responsible for movement and locomotion, as it connects the limbs to the axial skeletons and allows interactions with the environment. Moving on to the next one, which is the classifications and functions of bones. Bones are classified based on their shape into 5 main types. Long bones, such as the femur and humerus, are important for movement and support. Short bones, like the carpals and tarsals, provide stability and limited movement. Flat bones, including the skull and ribs, protect internal organs. Irregular bones, such as vertebrae, have complex shapes and specialized functions. Sesamoid bones, like the patella, develop between tendons and help to reduce friction. Bones have several important functions. They provide structural support, protect organs from being damaged. For example, the skull will protect the brain, allow for attachment of muscles that help movement, and last but not least, bones also involve in hematopoiesis, which is the production of blood cells in the bone marrow. Next is the anatomy of muscles. There are 3 main types of muscles tissue in the body, which is the skeletal muscle, smooth muscles, and cardiac muscle. So skeletal muscle is striated, and they are responsible for voluntary action and attached to bones. It is responsible for body movement and also posture. Next, cardiac muscle is striated but involuntary and is found only in the heart. And smooth muscles is non-striated and involuntary, and it is found in internal organs such as the intestines and blood vessels. Now let us look at the microscopic anatomy, which is inside a muscle fiber. So at the microscopic level, each muscle fiber will be surrounded by a membrane called the sarcolemma. Inside the fibers are myofibrils, which are made up of repeating units called sarcomeres. Sarcomeres contain actin and myosin filaments, which slide past each other to produce contraction. The sarcoplasmic reticulum will store calcium ions and release them when a nerve impulse stimulates the muscles, which allow contraction to occur. So this structure is essential for normal muscle function. Now let us look at the types of joints. So joints are classified based on their structure and degree of movement. We can divide joints into solid joints and synovial joint. So for solid joints, we can divide them again into fibrous joints and cartilaginous joints, and they have their own descriptions. So for fibrous joints, these are the joints that are joined by dense connective tissue and allow little to no movement, such as sutures in the skull, kyphosis, and syndesmosis. Next, cartilaginous joints are connected by cartilage and allow slight movement, such as the pubic symphysis and also synchondrosis. Next, synovial joints are freely movable, and they contain a synovial cavity filled with synovial fluid for lubrication. For examples Examples include hinge joint, ball and socket joint, pivot joint, condyloid joint, saddle joint, and planar joint. Now onto the next part, which is the physiology of the bone, that is the bone remodeling. So bone remodeling is a continuous process that allows bones to repair and adapt to stress. So the first stage is hematoma formation, where the blood vessels rupture and a blood clot will form at the fracture site. This is followed by bone generation, where the fibroblasts and osteoblasts will begin to producing collagen, and spongy bond is bony callus formation, where the soft callus is replaced by a hard bony callus. Finally, during bone remodeling, osteoclasts and osteoblasts will reshape the bone to restore its original structure and strength. So this process may take several months or even for years. In addition, let us look at the biochemistry of the musculoskeletal system. So bone is composed of both organic and inorganic components. The organic components mainly consist of type 1 collagen, which provides flexibility and tensile strength to the bone. The inorganic component is made up of hydroxyapatite crystals, which are composed of calcium and phosphate. So these crystals will give bone its hardness and ability to resist compression. Calcium and phosphate are also essential for normal bone mineralization and maintaining bone strength. Vitamin D plays an important role by increasing the intestinal absorption of calcium and phosphate. Without sufficient vitamin D, bone mineralization is impaired, which lead to weak and fragile bones. Skeletal muscle functions also depends on biochemical processes. Muscle contractions require energy in the form of ATP. So ATP is supplied through three main energy systems: the phosphocreatine system, which provides immediate energy; anaerobic glycolysis, which supports short-term high-intensity activity; and aerobic oxidative phosphorylation, which supplies energy for sustained muscle activity. Moving on to the clinical examples, which I chose: limb length discrepancy. So limb length discrepancy, or LLD, refers to a condition where one limb is shorter than the other. It most commonly will affect the lower limbs, where one leg is shorter than the other, but it can also occur in the upper limbs, where one hand or arm is shorter than the other. Now, lower limb discrepancies are more clinically significant because they directly affect posture, gait, and weight bearing. So LLD can be congenital, meaning that it is present at birth due to abnormal bone development, or acquired limb length discrepancy may occur due to trauma, such as fractures involving the growth plate. Other causes include bone infections, tumors, or surgical damage to the growth plate. Common clinical features including limping, pelvic tilt, abnormal gait, and in long-standing cases, lower back pain or scoliosis. Treatment of limb length discrepancy can be divided into non-surgical and surgical management, depending on the severity of the discrepancy, the patient's age, and functional impact. In mild cases where the difference is small and does not significantly affect walking or posture, surgical treatment may not be required, so these patients can be managed conservatively using shoe lift, which will help to equalize limb length and to reduce strain on the pelvic and spine. However, when the discrepancy is moderate to severe, or when it causes pain, abnormal gait, or postural problems, surgical intervention may be required. So, one commonly used surgical method in growing children is epiphysiodesis, which involves slowing or stopping the growth of the longer limb so that the shorter limb can catch up. In patients with larger discrepancies, or in those who have complete growth, limb lengthening procedures may be performed. This involves surgically cutting the bone and gradually lengthening it using external fixators or internal lengthening devices. Now onto the last part, which is the orthopedic specialist and historical contribution. So I chose Sir Robert Jones because he was called the father of modern orthopedics. So he gained that title because he introduced systematic treatment of fractures, and he also promoted the Thomas splint, which is designed by his uncle. This method has helped save many lives, especially in femur fractures. And Sir Robert Jones also played a key role in establishing the British Orthopedic Association, and he also have contributed in military, where he served as a director of military orthopedics during World War One, and he organized care for thousands of injured soldiers, and he helped to rehabilitate and retrain soldiers so that they can return to their duty again. And he was also an early user of X-ray or radiography for diagnosing bone injuries. And he also founded the Robert Jones and Agnes Hunt Orthopedic Hospital and promoted open-air treatment to improve patients' recovery. And last but not least, his legacy is he helped to establish orthopedics as a separate medical specialty, and his methods has influenced orthopedic practice worldwide. In conclusion, the musculoskeletal systems plays a vital role in movement, stability, and also protections. So by understanding its anatomy, physiology, and biochemistry, it is essential for us to diagnosing and managing orthopedic conditions such as limb length discrepancy. That is all from me. Thank you.